Hi friends,
Good
good
evening and
morning.
welcome to my channel Mookambika Nursing. Friends, today in this video we can see the next set of questions from anatomy and physiology. Yesterday we saw the first 10 questions from anatomy and physiology, that is first MCQ section. Today we can see the next section. In this first 10 question is like fill in the blanks type question, and next 5 question is multiple choice question. We will see the question one by one. The first question: CSF is secreted into each ventricles of the brain by choroid plexus. So CSF is secreted by choroid plexus. And the next question: CSF pass back into blood through tiny diverticulars of arachnoid matter is called arachnoid villi. So, first question: CSF is secreted by choroid plexus and CSF pass back into blood through by arachnoid villi. And the next question: CSF is secreted at the rate of about 0.5 ml per minute. Okay, and the specific gravity of CSF is 1.005. So, CSF is secreted about 1.5 ml per minute and its specific gravity is 1.005. And the next question's largest part of the brain is cerebrum. And the next question: the amount of cardiac output received by brain is 15 percentage. So the total amount of cardiac output received by brain is about 15 percentage. And the next question: cerebral hemispheres are connected by a mass of white matter is called the corpus callosum. And the next question: the first vertebrae is called the atlas. First cervical vertebrae is called the atlas, and the second cervical vertebrae is called the axis. And number of cervical vertebrae, total number of cervical vertebrae are 7, and number of cervical nerves are 8 pairs. These are some important points regarding cervical vertebrae. Here question is first cervical vertebrae is atlas. Okay, and the next question: an involuntary and immediate motor response to a sensory stimuli is called a reflex action. So, reflex action means an involuntary and immediate motor response to a sensory stimulus is called reflex action. And the next question: the endospinal cord, which resembles a horse tail, is called coda equina. And the next question: the area of the skin that is mainly supplied by a single spinal nerve is called the dermatome. So, dermatome means the area of the skin that is supplied by any area of the skin that is supplied by a single spinal nerve is called the dermatome. These are all some today's filling the blanks type question, and we'll see next multiple choice question. The first question is 21. The question: enzyme secretin and cholecystokinin are secreted by, and the options are option A small intestine, option B large intestine, option C colon, option D all of this. Here question is the enzyme secretin and cholecystokinin are secreted from where, that is the question. So here correct answer is among this option small intestine is the correct answer. Okay, the secretin is a digestive hormone and is secreted by the intestinal wall of duodenum. Actually, it is secreted from the duodenum. That is, duodenum is the first part of small intestine. So, the secretin is secreted by intestinal wall of duodenum. And this cholecystokinin is also a digestive hormone which is released along with this secretin. Okay, so both are secreted from small intestine. Okay, and here our correct answer is option A small intestine. And we'll see the next question 22. Enzyme amylase is helpful in the digestion of, options are option A fat, option B carbohydrate, option C protein, option D minerals. Here question is amylase. Amylase is the enzyme which is helpful for the digestion of. Correct answer is option B. Carbohydrate is the correct answer. So, this amylase or thiolin or salivary amylase is an enzyme which is present in saliva and is helpful in the digestion of starch. Starch means carbohydrate. Okay, so the thiolin or salivary amylase helpful for the digestion of carbohydrate. Option B is the correct answer. Next question. Pancreatic juice consists of enzymes except, and the options are option A trypsin, option B lipase, option C amylase, option D pepsin. Here the question is, which one of the following enzyme is not present in the pancreatic juice? That is the question, and the correct answer is option D, pepsin is the correct answer. The enzyme which is present in the pancreatic juice include trypsin, chymotrypsin, carboxypeptidase, pancreatic amylase and pancreatic lipase. These are all the enzymes which is present in the pancreatic juice. The trypsins help for the digestion of protein and chymotrypsin help for the digestion of protein and peptides. Carboxypeptidase help for the digestion of polypeptides and peptones. Pancreatic amylase which help for the digestion of starch, and pancreatic lipase which help for the digestion of fat. Here our question is, pancreatic juice consists of enzymes except. Option D is the correct answer. The next question, the amount of gastric juice secreted daily is, and the options are option A 3 liter, option B 1.5 liter, option C 1 liter, option D 0.5 liter. Here the question is, how much amount of gastric juice secreted per day? That is the question, and the correct answer is 1.5 liter. Approximately 1.2 to 1.5 liter is the correct answer. Here 1.5 liter is the option, so 1.5 liter is correct. Okay, so this gastric juice may consist of enzymes like pepsin, renin and gastric lipase. These are all the enzymes which is present in gastric juice. Here question is the amount of gastric juice, that is option B 1.5 liters. 25th question, the volume of an average RBC is called. Options are option A mean cell volume, option B packed cell volume, option C mean cell hemoglobin concentration, option D mean cell HB. Here question is, the volume of an average RBC is called. Option A mean cell volume. Mean cell volume means the total volume of an average RBC is called mean cell volume. Option A is the correct answer.